Hey guys, thanks for listening to the Best Practices Show podcast. My name is Kirk Behrendt. I'm your host, and thank you guys for showing up to this great profession that I love so much. And I'm a little bit, today's a special one for me because I love bringing on my heroes. And if you guys have been listening to this show long enough, you already know I'm not that smart. And the key to the success of this show is just surrounding yourself with great people that are a lot smarter than you. And today is a great example of that. I got Dr. Gary DeWood on, and a lot of you have known him through your journeys in dentistry. One of the best teachers, one of the best human beings. Gary is one of those guys that unlocks the code for me and keeps things simple so that I can actually understand them. And today we're going to be talking about the two kinds of patients and why that's so important to you as a comprehensive or fee-for-service dentist. So you're going to freaking love this. So don't jump away from this. Just grab a pen and start taking notes because he's going to point out the future for us. Now, if you're here for the first time, I want to do a couple things. A lot of dentists, over 38,000 of you joined during the COVID conference. Some of you are young dentists. Some of you are dental students. If you're finding your way to the podcast for the first time, I just want to say this. Number one, welcome to a very inviting community. You've already known this. Dentistry is a very noble profession with a lot of great people. And you're part of a great community right now where there's no egos here. I want you to do me a favor. If you're listening on Spotify right now, just do me a favor. Go down to that little subscribe button and just hit the subscribe button because I want you to show up with us because you're going to see every single week. I'm going to bring you a brand new expert in dentistry that'll bring you best practices so you can create a better practice and a better life just like today. And I don't want you to miss out. Number two, if you haven't joined the Best Practices private Facebook group, make sure you do that because you're going to see there's over 13,000 of you in there, just dentists helping dentists and team members. If you have questions, it's awesome. You can post a question over there and you're going to see there's a lot of people that are just willing to help. And then lastly, if you're looking for resources, just improve your practice, join us over at actdental.com. You'll see we've got Act Dental U. We've got great people over there just can help you create a better practice and a better life. And here's why, because you get one shot at this thing called life. And the coolest thing about dentistry is there's no rules. You can create whatever you want. If you're a single column dentist, you can create a single column practice. If you want a big practice, you can create a big practice. There's no rules. The greatest thing is when you create a practice and you get out of your car and you walk to your building, and you go, I just love how I do it. That's the cat's meow, I think. So make sure you join us over there. Now I want to introduce my guest, Gary. I have known you for a long time, and you work for one of the greatest organizations in all of dentistry that helps dentists become amazing, even more amazing than they are, which is called Spear Education. Now, I always like to start here. If nobody's heard of Gary DeWood, number one, they've been sleeping in a closet or living under a rock. Who the heck is Gary DeWood? What do you do? And what is Spear Education?
Well, first of all, Kirk, thank you for that wonderful introduction. I always listen to those things when they get said, and you have always said those kind of wonderful things. And frankly, I always wonder who you're talking about because, that doesn't ever feel like me. I'm grateful for it though. So thanks. I'm just a small town dentist from rural Ohio who got lucky, met the right people at the right time. Had an opportunity to learn and teach at a place that kind of I grew up, the Pankey Institute, and another opportunity to help create what became Spear Education with Frank Spear and a wonderful group of people out in Arizona. So I consider myself just an incredibly lucky small town dentist. And I hope that some of the things that I can share are worthwhile with people. But I never underestimate and I never forget where I learned that all from. And I don't have much original stuff. It's just.
Well, then wherever your stuff came from, I'm the great borrower of your stuff because I still this day. And you guys are going to see how special this human being is to all of us. And I got to know you through my journey through Pankey.
Yes.
All the conversations. And then over the years, I'm even having tequila at Rouse's house in the back, like every single time with you, you add that much more value to my life. And I know you do that with a lot of people that are listening. And today we're going to be talking about a topic, and you've always taught this, but today we're going to open it up and go a little bit deeper and why this is so important to dentists. But there's two kinds of patients in the world if you're a dentist, and why this is so important. I always like to start with the why. let's go to the why before we go in the how. Why is this such an important dialogue in dentistry, Gary?
Well, if my mission is to do something that involves the patient, one of the things that I learned many years ago is that people coming to the dentist is like people going to a Broadway show. They get there, they're not exactly sure what's going to happen. Sometimes it can be unpleasant or even unwanted. But whatever happens is going to create an experience. And if that experience is one that exceeds their expectations, it's going to be remembered and valued. And so I've always considered what we do as performance art. And I don't mean performance art as in playing a role. I mean in being who we are, because that is also performance art, helping people learn who we are. And so for me, some clarity, if it's possible, about who's spending that time with me is incredibly useful. And that's why I've always kind of tried to decide, is there a way to figure out who's coming?
Right.
And what I came to over the years is I came to one basic initial separation that I found could be made reasonably quickly using a filter. And that will change the interaction that I can have with that patient because I have some idea who they are. And when I'm using the word filter here, I'm not talking about a filter to keep people out that I don't want there. A lot of people hear that, like I just want to filter out the people that I don't want. I'm talking about a photo filter. Photo filters provide clarity. They let me see better. And truthfully, I understand that the other filter analogy often works because if you ask the appropriate question, some patients will decide that you are not the place for them to come. And that's important too, because one of the worst things that can happen is when that doesn't happen and they show up and their expectations are not met, because we were never really on the same page. And unfortunately, they go out and they tell other people about those things. And in fairness, and we talk about them too, because I've been at dental meetings and I've been listening to what dentists tell me about some of the people who showed up. So it impacts us both when expectations don't get met. So for me, some clarity around who was coming just made it more comfortable for the team, me included, to create a different sort of an experience. And I think that the primary separation was this one. There are patients who believe they're healthy, and there are patients who believe they have significant issues.
Right.
Go ahead.
So let's define those two, because I love how you look at this.
All right. Patients who believe they're healthy, okay, think they're coming for the reason that we have trained the public to come to a dentist forever. And I will tell you that this isn't my question. This was Lisa's question at the front desk. She would ask people, what significant dental issues are you dealing with right now? And most patients said, I don't really have any issues. I just need to get my teeth cleaned. Okay. Now they often had some things. Sometimes they said, well, I do have a couple of things, but what I really need is to get my teeth cleaned. Or what I really need is to establish with a dentist. I moved new to the area. We heard you guys are great. All those kind of things. What they do is they walk away from claiming a significant issue. Okay. The other side of that, and by the way, we decided we will hear every one of those patients are healthy. They believe they're healthy. If they have an issue, it ain't significant. And almost always they already believe they know the answer. People who claim a significant issue are different. They're usually looking for answers. And so that differentiation made it possible to have some idea who was coming. And it doesn't matter how you choose to bring them into the practice. Cheryl and I always welcome patients in two different ways, either through us or through hygiene. And here's another thing I feel real strongly about. You want to build a practice that gives you what you want? Go create it and then fill it. My schedule has been pre-blocked for my entire career. I met Jim Pride before I graduated from dental school. And I really, for some reason, that clicked for me, the importance. We literally had our schedule blocked with new patient appointments always. So we had to answer how much was enough. And then we were allowed to change our mind. But we had to answer that question first and put it in our schedule, which means that we created performance times. You can plan something when you go and create it and block time out for it. Okay. Now, it doesn't matter how you choose to have people come. You can have them all come one way. If everybody comes in through hygiene, that's fine with me. Actually, and I heard this, I hear this from Kirk more than anybody else. And I love hearing this because he says, what do you want? Because there are no rules in dentistry. You can do anything you want. You want to be done every day at 3 so you can pick your kids up from school? You can do that. Try doing that in medicine. Or in any other kind of a job, a profession. It's really tough. Dentistry can be designed any way you want it to be. And if all your patients, you want them all come in through hygiene, here's my question for you. Would it still not be useful to have some clarity about who's in the chair? Would that change the interactions and the experience?
Amen.
Yeah, and maybe it would mean that first visit, prophylaxis doesn't have to occur.
Right.
It can. Nothing good or bad about it.
Okay, so I love this. Now, I want you to open it up even further too, because, okay, Gary, I'm a 32-year-old dentist. I'm listening. I totally understand what you're saying, but I got all PPO in my practice. You don't understand. I'm in this area. It's all PPO. Like, where's the future in this?
Oh, good.
You know what I mean? Like, because you and I talked about this before we went live. Like, if you're going to succeed in the future, you got to be clear about what you're building. And so give us your perspective on that.
Well, the first thing that I would tell you is that being in a PPO is a business decision. And one of the most difficult things for us to do as dentists is to step and have a business hat on. And I realize that it's always tempered by our experience as a dental professional. But at some point, the people who really can give you the most clarity for that are non-dentists, because it's a business decision. You decide if you have to have that happen because it provides the appropriate cash flow for you to be able to build careers for your team and all. I get that. And I think it can be wholly appropriate. Please don't think, we talk a lot about fee for service dentistry. All dentistry is fee for service. It's just who's paying the fee and who feels responsible for the fee. And that's a mindset. And so one of the things that I learned years ago was that I don't think that being in a PPO necessarily ties your hands. Because if the real interaction is between you and an individual, and all dentistry is one-on-one. I mean, that's how it happens. You can't, somebody said something to me about, all the stuff we can do in the virtual world, we can get so much more stuff done. And I say, there's a big problem with that in dentistry. 100% of our patients are analog, which means we got to go back to that at some point. We got to connect with that person. It's not about the stuff. So I discovered that many patients who came because I was in a PPO, it was worth the marketing expense that I chose to have. And I've only ever been involved with one, and it was many years ago. And so I guess it's a little bit disingenuous of me to say that I fully understand, but I've been fortunate enough to be gifted the opportunity and the privilege to be in a lot of practices and see things working. And I find that in many practices, it's worth that investment, that you are creating for yourself opportunities. And those people came because you were on their list.
Right.
And you might not have had that opportunity had you not been on the list. I also discovered that a certain percentage of those people who are not bound by that box. And that very often the box is a box that the dentist and the team have put themselves in. And then they view everybody who comes in that box. And I think that if we can find a way to free ourselves from that really made it possible for me to be able to look at a patient who was there because my name was on the PPO list and tell him something like this. I remember saying this to a guy one time, and he said, and I know you've all heard this, I don't know what the insurance will pay for. I said, that creates a real dilemma for me, because it's just a list of procedures. It's a benefit plan. Benefit plan is different from insurance. I'd be happy to talk about that, but let's just talk about what it is. It's a list of procedures. If you need those things, it says, here's the assistance you're going to get to make that happen. If you don't need any of that, you have no benefits. There's no benefit. And what if there are things on this list that there is no benefit for? Because there are things on the list of things that are possible there's no benefit for. So what I have to know right now is how you want me to treat you. And I don't mean the dentistry. I mean, how should I interact with you? I mean, do you want me to only talk to you about things that have a number here by them? Or do you want me to always tell you the truth? And I use the word truth and I look them in the eye. No one so far has ever told me to lie to him.
Yeah.
They all say, oh, no, 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 tell me everything. You see, I think that if you want to change the mindset around dental benefit plans in your practice, I think there are two things you can do. First of all, let's answer this question. What minds have to change first? Ours. If we believe that dental benefit plans suck, and we tell people that through our mindset, because believe me, whatever you believe is being transmitted. No matter how you think you talk, I promise you it's being transmitted. And the only thing that happens then is that people wind up together, you and the patient wind up in a little muddy hole whining about how terrible it is. Tell me how that benefits anybody. So I have quite literally, years ago, I said, I'm not going to do that. I mean, I remember people walking in and plunking down when they had to bring all the paperwork. You know, they had to sign all the forms ahead of time. They had to bring all this stuff, and they throw it down on the counter, and they would go, "I have this, but it sucks."
Yeah.
And you want to go, "Yeah, they all suck." Don't do that.
Stop doing it. Now you
Please
said
don't do that. You know,
two things have to change. It's mindset. It's our mindset. And what was number two?
Well, and then the culture. And I believe one way to change culture, which is part of mindset, it's mindset now translated to action. So here's my recommendation. Stop saying the words dental and insurance in the same sentence ever. In fact, stop saying those two words together in your practice without exception. Say benefit plans and dental benefits or benefits. People will start asking you things. Words are important. You want to change your mindset? Start talking about things differently.
I love that. I freaking love that. Now go back to this because, you know, when you're talking about the two kinds of patients, healthy patients, significant issues, you mentioned, and I wanted you to save this for the podcast. Recently, there was an article about the Mayo Clinic doubling its size.
Oh, okay. So actually this kind of came to me because I'm reading this article. Okay. And Mayo Clinic doubles its size to better serve the patients of Phoenix, you know, and Mayo Clinic's a wonderful place. I'm a patient there, actually. Cheryl and I are both patients at Mayo. I love they are comprehensive, you know, so it's kind of what we have an opportunity to do as well when we have close relationships with specialists, because it ain't at the same place. Let me tell you that. There are several places spread around Phoenix where Cheryl and I have to go depending on what specialty we're going to visit. It's all Mayo. Right. So I think it's a kind of a neat corollary for dentistry being comprehensive. It's the same sort of a deal. But I realized that people who go to the Mayo Clinic go there because they have issues. And even if those issues are, I just want to be more healthy, that's an issue that they own and they want to act on. It's an active involvement. In fact, if you've seen any of their ads, and I don't know if they run them everywhere, but it's great. They show people in situations that, you know, are sad. They have some disease process going on, and then it fades away, and there's a picture of the Mayo Clinic, and it says, "You know where to go." Wow. I remember putting those things together in my head, and I said, God, that's the difference. It's a beautiful facility. It's a wonderful place. There are incredible clinicians there. I can say all of those things about my office in Pemberville, Ohio. And I realize that's a little self-serving. And I'm not bragging. I think we did wonderful things with patients. 99% of the people who walked in my practice door thought they were healthy. They didn't have issues. If they had issues, they would have come with questions. Most of them didn't come with any questions. I think most dental patients think they're healthy. And what's interesting to me is that lots of dentists perpetuate that by not telling people everything they see or what's possible. Now, part of that is because they don't know those things. And I honestly believe this. I think that almost all dentists are doing the very best to help their patients see everything that they know. And unfortunately, a lot of dentists are practicing their first year of dentistry, even though they've been out there for 20 years. And things are different. Yeah. I mean, things change all the time. I was thinking about my initial exams years ago. I mean, I didn't look at how people breathe. The joke that I say to our groups here at Spear, I say, you know, I've been looking at people's noses for years, but now I do it with intent. Yeah. I mean, there's so many things that are different and change. We can talk to people about so many things, and dentistry can have an impact on that thing that I just started looking up their nose about. You get my point here. I think that we were trained to look for immediate issues and fix them.
Right.
And if we think the other way and say, can we head off some of these things? I think we would offer people different things because they would start to ask questions about those. And I know, you asked me to say this, so I'm going to say it. And what I learned in that was, first of all, I learned that I am absolutely, totally 100% a salesperson. So is everybody on my team, without exception. The number one thing you sell is yourself. The second thing is, in our situation, is health. And the patient's understanding of health will drive that. I mean, I'll give Mary Osborne credit for this because she deserves it. One of the best questions I ever learned from her. When you think about dental health, what does that mean to you? Ask people what they think about when they think about that. Yep. Because a lot of times they say things that are really wonderful things, and then no action happens. When we see things, now I can ask them a question. Kirk, I mean, when we met, we talked about what your definition of health was, and you told me you want to keep your teeth for the rest of your life. We've been seeing some changes the last couple of times you've been here, and you've chosen not to act. Could you help me understand what is different or changed for you? Didn't yell at you, didn't say anything. You get my point. My job is not to sell you the dentistry that I think you need. My job is to sell you on your current situation so you can look at me and say, what should I do?
Yeah. And this, as you're talking, you're pulling up like 95 things that you taught me. I used to think, dentistry was 10% business, 90% technical. And then I met you at the Pancake Incident and you're like, contraire, mon frere. You need to understand, like, business is a much higher. Can you share a little segment? Like, how important is it to understand?
So this is my belief about business in dentistry, because first of all, let's agree with this. 100% of everything that I do is elective. Sure. Nobody dies if they lose all their teeth. Not today. You can live your whole life with no teeth. Right. Right? Not, that wasn't always true. You lost your teeth, you didn't survive. Oh, right. No, that doesn't happen. You don't need teeth to survive today. So everything I do is elective. Now, I get argument about that, and that's wonderful because that means that people value dental health. Excellent. But it's a truism that I try to live by, which means that if that is the case, elective things are discretionary. So I have to find a way to help people ask for them because it has to be important to them, which means I have to find a way to understand what it is that they want.
Right.
And I realize I just got away from your question. So pull me back to the point of the question.
What percentage of dentistry is?
Thank you. Because that is if we think about it that way, we have to think about it, the business of dentistry, or you won't be there. Okay. And my belief is always that dentistry is 51% healthcare and 49% business. If there's ever a decision that has to be made and it involves the patient, the patient wins. And the example I use of that is, I don't care how good you are or how wonderful your hands are. At some point, you're gonna find something you did that ain't up to snuff. Something's gonna happen, and you're gonna go, "Wow, I don't know how that happened. It happens." What are you gonna do? I'm redoing it.
Yeah,
I don't have a choice. I mean, the example I always use is because I learned years ago. I actually have a strong argument against ever taking a radiograph of a crown before you seat it. There's way more risk in the radiation than there is in that thing not fitting if you've done all the steps up to that appropriately. Why would I zap you with radiation? And I believe that my whole career. You do all that other stuff right, you read the statistics. Right. What are the odds on that not fitting to the point where it would be not good to leave it? Pretty small. Right. So having said all that, you're going to see something on some bite wings sometime after you put something in, and you're going to go, when you get older, you go, did I do that? You go, look. But when you're young, you did it because you remember. And you look at it and you go, oh, crap. And you go, when did I do that? Now you got to tell the patient, what are you going to do? I have to take it out and redo it. I'm apologizing and saying, and patients don't like that and they love it at the same time. And I get that. But it doesn't matter if I can barely make payroll this weekend Friday's coming and I'm not sure I'm going to have enough in there for payroll. I'm hoping I still got enough in my savings to transfer it back to the practice. And I know that you deal with so many clients who go through everything I can ever explain, that you know these feelings because you experience them by being with people who are having them. And when it doesn't matter, it doesn't change that. It might change what I said. What I might say is, I'm not sure exactly what happened, but this margin is not closed and it needs to be. So what I need to do is take that crown off and replace it. And because I've left an open margin there, and I'm sincerely sorry for that, I'm happy we caught it. It doesn't look like it's done any damage to the tooth, but when I take it off, we'll be able to ascertain that absolutely. Whenever we do that, because of that, the tissue kind of can get in and around that. So what I'm going to do is I'm going to make a beautiful provisional and we're going to cement it. We're going to allow everything to heal and become just perfect before we go back and finish that crown. Because I just bought myself a couple of months. Maybe in a couple of months, I'll have enough money to pay the lab fee.
Yeah, no, for sure. Now you guys out there, you train thousands of dentists per year. Now we talk about the two kinds of patients, the healthier, significant issues. And I love talking to young dentists. Now I'm going to toss this question to you because I get this question. Okay. And I just had this conversation this morning with a dentist in their early 40s who's mostly PPO. They're like, I don't even know if it's possible. And this debate has come up a lot in the last couple of months. People are like, how do I move to more fee for service? And I've always been strong about it's not about writing a letter. It's not about raising your fees. It's not about you got to get good at something. And then the second piece of it is you got to understand it's a behavioral game. So when people come out to Spear, it's not about learn how to do flashy teeth. You're learning to get good at something that you build a reputation for that people speak about. Would you agree with that or disagree?
I would totally agree with that.
Okay.
In fact, I'm going to argue that there is one thing that you can become really well known for if you want to mimic Mayo.
What?
Diagnostics, observation.
Right.
Tell people what you see, all of it. Tell them everything that you see. Offer them partnership in this relationship instead of me being the doctor telling them the things that they should have or do. And part of that means that in order to do that, I promise you, as observation, you will learn the skills necessary to provide therapy for those observations, which means you'll become an exquisite restorative dentist. You'll learn to do complex restorative dentistry.
Right. Now I'm not going to argue with you. I'm going to interject because you and I both are a mutual student, and I'm going to tell them to listen. It's Dr. Mike Mead in Uniontown, Ohio. If you're in Ohio, just drive over to his practice. Nicest human being ever. So a client of ours, he's been off of Delta for 3 years, which means he's been fee for service complete. And I shared this with you because you're now training him. Kirk, does the panic ever go away? I'm so worried. And then in the same breath, he goes, it's so exciting. I'm going through Spear and I'm all into diagnostics. I don't even care if they say yes. I'm just all into learning about them and their problems. And he told me I'm 6 weeks out to get a crown in Uniontown, Ohio. And he's not an outlier. That's somebody who's focused on making his game better.
Well, here's what's really fun about that, because I see the next stage. What's going to happen is, and I say this because I experienced it and I know other people have experienced it, is that you have tons and tons of fee-for-service patients right now. They just happen to be enrolled in a PPO.
It's brilliant.
But that's not the box they think they're in.
Right.
We think they're in that box because that's how we view that group of people. They don't. This true story. I met a guy once who came in to see me. Actually, he came in through hygiene. This is when I was still with Delta Dental. So it's years ago, but I think this plays well today. And I've had dentists who have heard me tell this story who went back and kind of talked to people the same way and had the same thing happen to them, where somebody said, I only want what the insurance will pay for. And they did this when they do it. Have you ever heard of anybody doing this? What's this a universal sign for? Stop. And told Robin that. So when I came in to meet the new patient who came for his pro fee and his exam, had radiographs, I will tell you the man had no decay and he had no periodontal disease. He had a mouthful of really heavily repaired teeth. Here's another thing I stumbled on, which was really useful in my conversations with patients, and it made more sense. We didn't talk about fillings. We talked about repairs and restorations. Those are the only two things I'm capable of doing, are repairs or restorations. Repairs involve individual teeth in a way that we can go in and we can repair some things. And as long as there's enough structure of tooth to hold the repairs, some of those will last your whole life.
Right.
As soon as you have more tooth than repair, that's iffy. And so there's a continuum there. And your level of risk will determine at what point do we act.
Right.
And so having said that, I was talking to him. Let's just say he had lots of repairs that exceeded what I would consider the maximum, including on his upper 6 anteriors. So when he said that to Rob, and she told me that Mike only wants what the insurance will pay for, and she put her hand up too. And so I sat down and I did the exam, and I said, Mike, you have no decay. And I'm happy to say that, you're stable right at this point in time, which I think is a great thing. I mean, that's what we look for in health. We look for some stability. What do we know about biologic stability? It changes over time. So, the only thing I would say is you have some teeth that have a lot of repairs in them. And now because I'm very clear and I understand, your limitations on what you want us to do for you, I'm going to give you the names of 3 dentists who I think are excellent. And I have to ask you to see somebody else. And he looked at me puzzled and he said, what? Looked over at Rob and he said, are you asking me to leave? And I said, well, I want to be honest with you up front. There's nothing from this point forward you won't have to pay for. And you told me you only want what they will pay for. These things are the things they pay for. Beyond that, you're always going to have to pay. I'll never forget this because he looked at me, put his hand up, and he, whoa. I'm totally fine paying for anything if I need it. Wow. I said, so have you been places where people told you about things that you should do that you didn't need? His story was amazing. He said, well, you're the third. I've been to 2 other dentists in the last 18 months. And, I go in and I'm getting my check. Both of those people told me that I have to have caps on all of my teeth except my bottom ones in the front. And they said they all need caps. I don't want to have those. I'm not having those because I don't need them. And I said, okay. I would love to have you come here. You're welcome to be here. 6 months later, he came back in and he had broken a piece off a tooth. We scheduled an appointment. I did a giant amalgam buildup using amalgam bond. This will date this a little because it's back in the day. Okay. Not long after that, he broke another piece off a tooth. And he came in and I did another big, this time it was a whole lingual of a maxillary premolar. I built it in amalgam. Now he came for another visit in between. And then not long after he had been to see us, another tooth broke. And he came in. And so I walked in and I looked and I said, turned to Darlene and I said, get the amalgam stuff and I'll be back and we can get him done. And he actually reached out because I was standing and he grabbed my shirt. And he said, do you think I need a cap? I grabbed my chair. I set it down. I wheeled right up to him and I said, who are you? And what have you done with Michael? And he went, well, I mean, if you think I need a cap, that would make sense. And I said, you need a lot of them. Now, this is a guy who was firmly established. Let me tell you that within 24 months, all of the teeth in his head had full coverage restorations except his lower 6 anteriors, which tells you that wasn't all paid for by a benefit plan.
For sure.
He paid a whole bunch of stuff that would have been benefits because he wanted to do it now. That's the difference in people. Can you stay? Again, I'm going to give Mary credit for this. Mary Osborne taught me this years ago and said, if I could learn to live by this, I would have more dentistry than I could possibly do. She was right. Can you stay in the question until the questions come from the patient?
Absolutely.
Because if you can, they'll come. But I was not taught that. I was taught my job was to give everybody a list of what was wrong with them and then tell them how I was going to fix it. And if they didn't say yes to that, it was just because I hadn't educated them enough. And I'm going to tell you, I learned early on, education is grossly overrated, folks. The education that's necessary is not that stuff because it's all too logical. It's all logic stuff. We have to become better involved emotionally on an emotional level with the people in our chair.
Yeah. I totally agree. And it's all about you. Now, I don't know who said this, but I've heard this for years. The question is the answer. the better you get at questions, the more you're going to find solutions. And so
always.
Absolutely right. And guys, if you're listening to this, you already know this is why he is one of my favorite. Gary you found this, Gary, and even in your your travels around, your favorite teachers often didn't tell you exactly what to do. They got you to think bigger, a little bit better, because when dentists, the great Dan Sullivan from Strategic Coach has always said this: the problem is never your problem. It's how you think about the problem. When you think better about the problem, and like you said, putting patients in a box with this insurance, it has a trickle down effect. Now we're talking about patients restorative, but even before we went live, you mentioned like it trickles down to even how we devalue hygiene.
Oh, and totally and completely. If you think about what's happened in dental practices, the relationship between dentists and hygienists ostensibly has always been that as co-therapists. But I will tell you that in a lot of dentists' minds, we never saw what they do as important as what we do. And I get that, because to be perfectly blunt, for me personally, what I do is way more important than that to me, because I don't do that. You see my point? But unfortunately, I believe that kind of thing has been a little bit leveraged by some of the companies who are, I'm going to say, trying to provide a good thing for people. I'm all for dental benefits. In fact, when somebody tells me I have these, I know they're not great, and I say, I'm really happy you have a dental benefit plan. Totally happy. I love it. That means you're going to get some assistance toward whatever level of dental health you've decided is exactly right for you. Could you help me understand what level you've decided on? And then I look at them and I wait. Nobody can answer that question because nobody ever asked them that question before. Most common reply, I didn't know I could make a choice. Immediate reply, aren't you glad you can? Let's take them to where they can claim that, because it's a different kind of a conversation. So I believe that what's happened is the fees have been driven down so much, especially on preventive services. And, I try never to say bad things about any business, because it's a business.
Right.
So dental insurance, insurance companies that have dental benefit plans, it's a business, and that business is expected to be profitable. I get it. I'm 100% behind that, which means that I don't try to say negative things. I think that they're a little disingenuous sometimes when they talk about all their stuff around health, and yet they will compensate no one for taking time to tell people how to maintain themselves at home and teach them. Zero benefit for that.
Right. That's
included. Okay. Why would it be included? Isn't that part of what we have to offer people? Why would a prophylaxis be something that you don't pay enough for that I can afford to pay a hygienist? I have to pack them into a period of time where they can't always do it in a thorough manner. Now, in some ways, we've contributed to that by making it be a set schedule. Different patients require different amounts of time. Are you willing to do that and then find a way to be compensated? Well, if you're only getting X, it's hard to be able to do that. I understand all the downsides of all this stuff. But I think that what's happened is it's kind of driven a wedge between dentistry and hygiene, and we don't think of ourselves as co-therapists. One of the things that I'm encouraging people to do right now is if new patients are coming in through hygiene, I'm encouraging the hygienists that I get to spend some time with, that they should introduce themselves as, welcome to Dr. Gary and Cheryl DeWood's practice. I'm happy to be able to welcome you for your new patient visit, and especially because it's a healthy new patient visit. My name is Robin. I'm the periodontal co-therapist who works with Drs. DeWood.
Love it.
Say something that's a value statement about who you are and what you do, because you don't clean teeth.
Right.
In fact, here's another one that you can take home. You want to change your mindset about something? Let's change how we talk about it. We stopped using the word cleaning in my practice. We don't have those. We have hygiene therapy visits.
Yeah.
Okay. This is what we would say when people would say cleaning, because you don't want to correct people. But what I would say when people would say, yeah, I need to get that appointment to get my teeth cleaned, I would say, cleaning is what you're doing every day at home. You do a good job. Way to go. When you come for hygiene therapy, everything you accomplish in cleaning will be done, but there is way more than that happening.
Oh, I love it.
Why don't we say that? on an ongoing basis to everybody who we get to have a chance to talk to, so that they can hear that there's something different than that. I've heard this said by dental team members. Yeah, I know, don't worry, it's just a cleaning appointment. Really? What did you just say?
You just said that you devalued what you do.
Amen. I think that the current issue, because there is a little bit of an issue right now between dentists and hygienists. I don't know if any of you guys out there read the ADHA or read those things, but they had an editorial in there. I mean, that was angry, baby. If you have not, there was lots of anger, lots of fear. There was a lot of stuff going on in that. And to me, that's an opportunity.
Right.
Whenever a divide is exposed, for whatever reason, it's an opportunity for both to look at each other and go, no, man, I like you. I love you. We got to find a way for us both to feel good about this, because I want the partnership. You know, my thing when I said I kind of devalue it automatically because I value what I do more. That's why I need their partnership, and why I have to value what they do totally.
For sure.
That'll change everything.
It will. And I value our partnership. And I know I don't get you all day because I could talk to you for 2 days on this whole thing. And I know you have to do a very big seminar here shortly. So I have to ask you a few more questions before we wrap this up and bring this home. But, Gary, I believe in what you guys are doing out there at Spirit. Now, as you can already get not only are you going to learn great things technically, which is the stuff that we all love to see, but you're going to change the way you talk, the way you think when you get around great educators. And so, Gary, I want you to answer, number one, I'm a young dentist. I hear what you're saying. I've always wanted to go spirit education, but I don't have the money. I don't have the time to do it. Gary, help me with that one, because you hear that and I hear it. I'm like, oh gosh, people say, and what are they going to teach me that I didn't learn in dental school? I'm 31. I got to get this practice going. What would you say to a kid who says that?
Well, let me go to it. There's a couple really good points in there. What are they going to teach me that I didn't learn in dental school? Nothing. But you'll hear something totally different. Let me just offer you that. One of the things that I learned early on, and I've still done this to this day. Actually, I'll use one of my teachers who illustrated this for me really, really well. There's a guy named Henry Tanner, and many of you don't know who this is, but he was, to me, he was one of those people who I learned so much from. And I had an opportunity to do a presentation to a group, and Henry was in the audience. And I'm watching, and he's taking notes. And so at the end of the thing, I went up to him and I said, Henry, what are you writing down? What can you possibly write down that I have to say that you don't already know? And he said, oh, I heard lots of things I didn't know because I never heard you say them before. Every time you go anywhere, I will promise you, it could be the same program. You will not hear the same stuff.
I agree.
So I offer that for what it's worth. I understand the money thing. And then I say this and I realize it's self-serving. So at this point in my career, I could say it before when I wasn't doing this. When I was practicing, I was still saying this to people who were young, who came to me and said, how did you get your practice like this? And I said, I found ways to invest in myself. And for me, that was continuing education. I learned how to look at patients differently, and that paid off. And I got that advice from somebody. My preceptor in dental school looked at Cheryl and I. We were both in the same class. He was our preceptor, both of us, and he looked at us and I said, do you have any advice to give us as we depart? And he said, yeah. Sometime in the next 3 to 5 years, you're going to feel like buying new furniture for the living room. Go take some really good CE instead.
Awesome.
And so Cheryl and I always budgeted in money for CE. Now, I realize also that really early in your career, that's hard. And it's one of the reasons why I think Spear Online is a great thing. We have lots of stuff. You can find stuff everywhere. The stuff that we have is clinical stuff about us, actually all kinds of stuff, around practice and practice management even, and stuff like that. And you can find wonderful stuff like that at ActU. I mean, there's stuff out there that you can afford to get into that will actually allow you to go back and get some of the benefits of that information. And I think you'll see a change in things. So first step is something like that. As soon as it's possible, never underestimate the fact that most places that you would want to go learn want to find a way to help you pay for it.
Right.
So you may find that if you go and call somebody, that there are ways that you can arrange to make payments and do all those things, just like we do with our patients.
Right.
Because in many ways, I haven't changed what I do.
Right.
I still work with people that what I hope I help them do is own something that they see that they want different, and then find a way to help that happen for them.
Yeah. And I'll go a step further too. And I'm a little bit old school, but Gary, I believe, like, even when I had little kids, I needed to go away. And when Sarah would just immerse myself, it was great. Like, we joked, Murph made me sleep on the couches in the and then just get into it. It's not like I'm looking at my computer.
Actually, I want to make a statement to that, because you spoke something I haven't thought about for a while. When I first went to my first really intense learning experience, it happened to be at the Pankey Institute. And when I came back, Cheryl picked me up. Remember, we're practicing together. Picked me up, and she said, "You drive. I'm going to take notes. Tell me what you learned." So I got in the car, got in the driver's seat. I started the car, and she got out her clipboard. She's got paper there, and I didn't say anything for a little bit. And then she finally said, "Okay." And I looked at her and I said, "Nah, you got to go." I can't tell you. Dr. Pankey told me something about that. When I met him, this was at C1, and he said, "You look excited. This is the end of it." And he said, "You look like a man on fire." I said, "I am." He said, "You're going to change the world." I hope so. He said, "I want you to do me a personal favor. When you go home, I want you to make haste slowly." And at the time I thought, well, he's really old. That makes no sense to me. So fortunately, he kept talking. And he said, "Please understand that the things that you learned here and the things you want to change are wonderful things. But the experience is why you want those things. Nobody who needs to travel the path with you that you need to make happen when you go home has had the experience. So when you go home, don't share what you want to do. Share the experience."
That is
wow.
I love it. Okay, I know you got to run. I have one last question.
Yeah,
as we're shooting this, it's March 31st, 2021. Everyone's anxious to go back.
Oh, thank you. We are open.
We're open.
So our workshops, we are fully open. We're finding that pretty much everybody who's coming is vaccinated. We are still taking precautions. We do have plexiglass up in the labs and stuff. We do all the normal dental precautions anytime we're doing things in an operatory together. And as of this date, as far as I know, and the president of the ADA has been keeping me informed, he's from Arizona, so he's a good friend. There has not been a documented case of transmission to a patient in a dental practice, and nothing the other way as far as has been documented that's where we believe it happened. So I think those precautions work. So we're still at this point, we're not back for our full seminars yet. And I'm not sure that won't change sometime in the not too distant future, because I'm hopeful that what we're going to see as we start to emerge is that using the simple precautions that we can actually can enable us to vaccinate our way out of this. I'm hopeful.
Okay. I lied. I got one more question. Okay. So I'm an outsider. I haven't been to Spear. I want to go. Where do I start? What's the first conversation?
Well, thank you for asking that. I'm very appreciative. You can go to speareducation.com and bum around on the website, see the things that we have, look at things we do, and then you can make contact with any of our team. I would be happy to hear from any of you. And my email is just gdewood@speareducation.com.
Yeah, but I got to ask, do I take facially generated treatment planning first, or which one? Like, that you get all these questions. Am I going to take?
So the first question I would have for anybody, and I would ask you this before I could recommend what I think would make the most sense for you. My first question to everybody who's ever asked me that, what should I take, is what do you want to learn?
Yeah, there you go. Dude, you're the best.
Because we have some different ways for people to enter into the things that we do.
I love it. I'm going to encourage you to check it out. They just do a phenomenal job. So if you're listening on your phone right now, you'll be able to flip up to the show notes. You'll see all the links to not only Gary's email address, and you're going to see he's very responsible or responsive and responsible. And you'll also see the links to Spear Education. So reach out, check Gary's stuff out there and all the great instructors out there. Gary, thank you so much, brother, for being on. I want to have you back again.
Kirk, you are a gift to dentistry and to dentists. And any of you out there listening who get any time to spend time with this man, you need to do it. So find a way to make that happen.
Very kind of you, brother. Awesome. Awesome. Well, stick
Thanks,
around.
Kirk.
Always say goodbye to everybody else, but thank you guys for listening to the Best Practices Show. Keep sending us suggestions for things that you want to hear from Gary, because I'll get him back on and we'll ask him the tough questions and get the answer straight from him. And then anything else you guys want to see, just let us know. But until we talk to you again or hear from us again, keep watching the Best Practices Show. You guys enjoy the rest of your day.
Thanks, everybody.